Special thank you to our sponsor, iGenX. iGenX isn't just a small business. It's a powerhouse ally ready to tackle your agency's toughest tech challenges head on. Specializing in low-code, no-code solutions, advanced analytics, and project management, iGenX is your go-to partner for both federal and commercial projects. But what sets iGenX apart? As a Salesforce Summit-level partner, the company brings unparalleled expertise across the entire Salesforce ecosystem. From MuleSoft and Einstein and Tableau, the expert teams at iGenX don't just build solutions, they engineer them, crafting robust data pipelines and creating stunning visualizations that drive real results. At iGenX, success isn't just a goal, it's a promise. The team is dedicated to delivering measurable benefits that transform your operations. Ready to partner with iGenX? Contact the team at info@igenx.com, spelled info@eigenx.com.
We're serving millions of veterans every year.
Right.
And we have over 170 medical centers, over 1,500 CBOCs, which are clinics, as well as all of the outreach we do with community care. So the direct correlation of my work impacting those end users that are so unique and have very special and integral problems that need to be solved is a motivating factor in why I chose the VA.
Welcome to GovCom Unfiltered, where your journey through the labyrinth of federal contracting begins. I'm Alexa Choi, your guide and host on this epic adventure. Here, we dive deep into the heart of government contracting, shedding light on the heroic tales of those who navigate its complex terrain. Our mission? To bring you closer to the action, revealing the critical steps, triumphant victories, and occasional pitfalls that our intrepid adventurers face. Your journey into the world of government contracting starts now, and we could not be happier to have you with us. Let's embark on this adventure together.
Thank you for joining us on GovCom Unfiltered. Today, our guest is Sarah MacDawutey. Very much looking forward to talking to her. So, Sarah, please introduce yourself.
Hello, GovCon Unfiltered. My name is Sarah MacDawutey. I'm currently the Acting Deputy Director of the VA Innovation Unit at the Department of Veterans Affairs.
Wow, such an awesome title. And I know I just recently met you at the Innovation Awards and had a chance to talk, and I was really inspired by you and the work that your office does. So of course, whenever I hear these stories, I want to know, like, how did you get here? What steps did you go through to get where you are today? Have you been on the contractor side and the government side? So tell us all the things.
That's a really interesting question. And my journey has taken me to places that I never could have imagined as a young girl. So I got my start working in healthcare as like a certified medical biller and coder. From there, I started trying different avenues of being in that industry and ended up working being hired into the NLP department within 3M. My work at 3M was amazing, and it introduced me to the technical aspect of healthcare. Prior to that, it was more, production type work for me. They also made the mistake of introducing me to Agile and Scrum. And so from there, I got certified as a Scrum Master. I started working as a Scrum Master and later began coaching as an Agile coach with a contractor. I then expanded my role within the VA as a product manager. During COVID, I took a course on human-centered design and kind of product management and really started to hone my skills there and use that knowledge and experience to kick off some initiatives within the VA that have, greatly affected and moved the needle for how we do things at the VA. So my journey is a little longer and maybe more twist and turn than most. And then from being a contractor, I crossed over to being a civil servant in April of 2023. So just over a year ago. Now I joined the VA Innovation Units, where we focus heavily on new and emerging technologies and how we can leverage those to solve real world problems for not only our healthcare aspect, but also for benefits and operations and how we deliver products to veterans more sustainably and more efficiently.
Wow, what a story. I really like how you went into the Scrum Master role without not through the general routes of, being a developer or some of the more common ways that folks get into that role. I did the same. I have a question for you that's not on the list. Sorry, this happened.
Okay.
So there's a rumor in the Agile community right now that the Scrum Master role is going away. So I'm curious, do you think that's true?
I would be sad if the Scrum Master role went away. From being an active Scrum Master, I know the value of what they can bring to the table and how they hold things together. I took my job as a servant leader extremely serious when I was a Scrum Master. So if that is the case, I think we'd be doing a disservice to how we develop software, because it is a critical role to keeping the team organized, to removing those impediments and ensuring that the team has what they need to continue producing amazing products. I've worked with both Scrum teams that were both development teams and non-development teams. So we had teams of medical coders that, adhered to the Scrum practice so that they were in alignment with how we were developing the software side of things as well. And personally, through my work as a Scrum Master, I've applied that into my own life. Like when my parents were moving to Florida, I tell people this all, and they laugh at me all the time, but I literally scrummed them, is what I called it. So every day I would call them and say, so what did you get accomplished today? What you got planned for tomorrow? And, do you have any problems that, you want to talk about? And literally they got their house packed up, moved to Florida, and had to move my mom's parents as well. When we look back on that, my mom always says, that format helped her keep going, because every day she kind of had to think about, okay, this is what I got accomplished today, and here's what my highest priorities are for tomorrow. We will lose touch of some of the more important features of Lean and Agile and Scrum development if we don't have Scrum Masters. So I hope that that's not true. I will caveat that with, I do think Scrum Masters have a limited span, like they expire pretty quickly within an organization. Typically it's about 2 years. Once you get people onboarded and get them really high functioning, they can typically roll off and go either into different projects within the same company or off to something different. So that may shorten, and that I could completely understand and see why people would want to have the Scrum Masters kind of constantly turning over, right? But going away completely, man, that would hurt my heart.
Well, the way I think about it, right, is if there was a lot of more AI in the metrics piece, like your burn down, burn up charts, and this and that, and velocity and planning poker, and some of the things that Scrum Masters do regularly, if that was to go into an automated function, which probably will, right? Then I wonder if it leaves room for Scrum Masters to be more human and to create those opportunities for emotional safety that, Agile tries to lean into so hard, right?
That's so true. When I worked as a Scrum Master, my first role as a Scrum Master, we had an extremely high functioning development team that was creating brand new functionality every single week. I mean, that was just an amazing team all around. But they also had a lot of emotional and non-work related things happening. We had one team member who had a bit of language barrier. He just had a very thick accent. And we had another team member who needed more emotional support. There's always room for conflict resolution. There's always room for meeting facilitation. And I think if anything, Scrum Masters are valuable in that meeting facilitation because they focus on gaining the actual value out of the discussion, right? They keep people focused. They make sure that everyone is heard. Any good Scrum Master does anyway. So I can see where there's a lot of things that could be automated. And I am definitely, as being in innovations, I'm all for automation and AI. But there's a very human part to being a Scrum Master and keeping the team together and high functioning.
Right. Wow, this whole conversation took a left turn. I didn't see us talk about Scrum Masters for so long, but hey, I'm here for it.
Yeah, me too.
Let's get back to you for a second.
Okay.
What inspires you the most about your role, and why the VA?
Well, why the VA is easy. That's because we have one of the most interesting and unique patient populations in the entire world. And that's on purpose, right? We also have a huge patient population. I think last I checked, we're serving millions of veterans every year.
Right.
And we have over 170 medical centers, over 1,500 CBOCs, which are clinics, as well as all of the outreach we do with community care. So the direct correlation of my work impacting those end users that are so unique and have very special and integral problems that need to be solved is a motivating factor in why I chose the VA. Now, what inspires me in my role? That's a bit of a difficult question. I think I draw from the very amazing leadership that I have, who has built this environment that focuses on getting things done rather than the red tape that exists within the VA and within government in general. And just being able to understand the process, but find ways to still get the work done in a timely manner. So it's a very interesting place to be because we see the impact of things quite regularly. Recently had a product go live where I got to attend in person, and listening to the nurses and the surgical staff and the environmental staff that are all a part of this particular product and how much this is going to improve their everyday lives is one of the motivating factors as well. So trying very hard to glean what I can from my leadership, but also build a path forward for, emerging technology where I get to kind of lead some very cool things.
Nice. That's very exciting. I was at the APBI a couple of weeks ago, and I have to say, blown away by the VA's organization, by the way that they connected the dots between the different governmental agencies at the top and the CIO, how everybody kind of works together. I was just like, you're absolutely right. This should be the model for every agency. It was really impressive. They really blew me away.
Yeah, we hear that a lot. Our CTO and his vision overall of, and he always says this, building better things faster, really kind of catapulted the VA into the forefront of digital services and how we implement digital services and making the lives of veterans easier, right? So a big portion of that is moving their manual applications online, exposing their medical records, and integrating with different products to improve their care overall. But yeah, I completely agree. If it wasn't for the environment and the culture that is being stood up, around OIT in the VA, we wouldn't be able to be as successful in innovations as we are.
Right. Yeah, really, really cool. Okay, so let me take a little bit of maybe a right turn this time. What do you think our responsibilities as women leaders are in tech for the next generation? What is your role, and how do you operationalize your role? I guess, how do you lift up the next generation?
That's a great question. So oftentimes when I attend events, I see very distinguished, very, very polished representation of women in government in high places, directors, C-suite level, and above. And I think that's what we can do for the next generation. We need to keep showing up. We need to keep being good representation and keep opening doors for those behind us so that they can follow and come in with their new fresh eyes and opinions and thoughts and really start to shape the world for the future. I think with every generation, we kind of have to do that. We have to pave the path, but then leave that door open for those to follow behind us.
I love this answer, and I'm actually gonna not go to the next question because I have a follow-on.
Okay.
It's the first time ever that there's so many different generations working at one time in any given workplace. So how do you work with some of the younger generations? And I know that you and I are of the same age, so it's kind of like myself too. Like, how do you make sure that the younger ones feel connected and the older ones feel in the mix and relevant? And what is your role, and how do you help make sure that everybody's kind of experiencing this in a positive journey?
Mm. Well, I'm thinking of a more recent experience. My team right now, we kind of have a bit of it's not a huge generational divide, but definitely multi-generational within our team. And I think for every generation, right? They want to be heard.
Right. That's true.
They
Yeah.
want to be seen.
Hmm.
They want to know that their voice matters. I know that's a big thing for me. In fact, I have it written on my little corkboard over there. Your opinion matters, because it does.
Right.
And so I think with all of the different generations, we have to make sure that we give them the space to speak up. And that is definitely pulling from my Scrum Master days. I used to
Yep.
sometimes just round robin, because you tend to
Yep.
have people on calls that are very vocal, very straightforward, very, upfront. And they can sometimes overpower those who are quieter. Strategic pauses in conversation after asking a question to give everyone an opportunity to take themselves off mute, muster up the courage, ask a question, or provide input, or just calling on people and saying, hey, we haven't heard from you this entire call.
Mhm.
What are your thoughts on this? How are you feeling about what we're putting together? By doing things like that and actively engaging everyone, we kind of level that playing field. I will say all of that is great, but I want to encourage everyone to be open and willing to try things that the other generations are doing. So we never want to get stuck on a specific tool or a specific process, and being willing to allow others to interject, either from experience or from a fresh perspective.
Love it. It's a great answer. Yeah, and it's funny because one of my other super great awesome connects started a whole concept around reverse mentoring. So it's
Mm,
like, what can we learn from that younger generation, and how do we make sure that the ideas that they have can be not only heard but then actioned on as well too, right?
mhm.
So that's great.
Federal proposals, your voice, less time, exceptional results. Voltron gives you the power of custom language models to reduce proposal development costs by 54% and start to finish submission time by 63%. Voltron is the only AI platform that synthesizes the valuable business development and capture information you obtain to write high-quality compliant proposal content specific to your company and each solicitation. Stop throwing it over the fence. Schedule a demo today at vultron.ai.
When it comes to AI, do you think it's here to help us, save us, hurt us? Like, what are your vibes on the whole AI thing?
I love AI. I've actually got a couple of projects and products under my belt and innovations with AI and different applications of how government specifically can use AI. I definitely think it's here to help us. I
Yeah.
also think it's here to stay. So for everyone who thinks that, this is just a phase, I have to beg to differ there. But it can be useful in ways that people don't realize. And so I encourage you to play around with it. Download ChatGPT, try it out, because AI is so much bigger than just, artificial intelligence. When you start getting into the various subspecialties like Gen AI or NLP or machine learning, right? We're doing things like around predictive medicine that is
Mhm.
going to change the way we view healthcare, where we're no longer reactive in healthcare, but again, predictive, in that
Mhm.
we're able to foreshadow and catch things prior to ever before, being that we have machines to go in and look at all of the data that we have. And VA does have a lot of data. So we're poised to be at the forefront of how AI is used to improve care to veterans, but also to patients in general. So for me, AI is definitely a helper. It's probably a bit of a leader in some situations as well. And we all need to figure out how to leverage it in our jobs, in our everyday lives, in a way that's beneficial.
So, question for you.
Mhm.
Not on the list. Sorry about that. When it comes to the future and predictive medicine, which I think is a really hot thing right now, how do you balance the privacy aspect? I think that's the one thing that everybody kind of gets hung up on when it comes to ultra personalized. I forget what the fancy AI term is for it, for like the ultra personalized AI sort of stuff. Cause it's like, wow, it knows this about me, it can predict this. But like, how do you balance that privacy piece? right? Like,
Mhm.
like uploading your entire medical history to an LLM, for example, right? So,
Um, yeah, I don't think that we'll ever have to upload your entire medical history to an LLM, right?
right,
Maybe there's a use case for that somewhere, but what I'm seeing right now in the field is we build out a model. Many times we're training on synthetic data.
uh,
And then we push the model into production where it is already trained to look for very specific pieces of data.
okay,
And we're typically, a lot of times, only feeding it very specific pieces of data. So our AI projects right now are typically uh, very use case specific. For example, interstitial lung disease, or right now we have an NLP project happening with external mammograms. So we're
right.
getting PDFs or other file formats, as well as the images, and having the NLP trained to read those things, pull out the important stuff, and then push that into the medical record. So with that being the case, we really reduce the risk of having, overloading it with too much personal information.
Right. I guess it kind of reminds me of back in the day when the census and the IRS has a lot of data, but if you put them together and release it, then it's like the next level up of PII, right?
Mhm.
It's like the ultra personalized. So I feel
Yeah,
like that's probably in the healthcare AI space, like that's something that people are already thinking about, right? And like,
absolutely. And the VA has established, actually, going back to, it was a congressional mandate to have a specific job at every agency to
mhm,
do data governance, right? And responsible AI is part of that
yeah,
whole umbrella of what's happening as AI just explodes within the government, right? So we have some really smart people working on governance and how to ensure that all of the AI is handled ethically, as well as the data is not being overshared. So we typically won't send any PHI or PII into a large language model. And a lot of what we're doing is behind our firewall. So we have that extra layer of security as well. So between those two things right now, I think we're in a really good place and able to, like I said, run things on very specific pieces of data and focus in and hone in without giving too much away.
I like it. This is a really exciting topic. I went to an AFCEA meeting up in New Jersey and they were talking about doctors using AI to listen in to
Mm.
meetings and then kind of take that out and distill the notes and, all these really cool methods of just reducing mistakes and moving things faster. And I think the future is really interesting about where we could go with all of this.
Absolutely. I think one of the main use cases that people miss with AI, and it's actually a really big subsection, is something that I call curated chatbots. So
Hmm.
instead of, just having a generalized open large language model, what you do is you fill the language model with your policies, your procedures, your documents, and then you have the chatbot generate responses to you. And in that way, right, it streamlines the whole process. It's secure, it's all internal, it's curated to exactly what information you need to see. And so we've run a couple pilots with that and they've gone over extremely well. So I think a lot of people will get a lot of use out of these quote unquote curated chatbots, as I like to call them, because it allows for a level of customization that I think people are not used to, especially when you're talking large language models. People think, oh, well, you have to be using
Yeah,
like very specific technologies like OpenAI or
yeah,
ChatGPT. But really, you can kind of take that and modify it for yourself and keep it
right.
all internal, which makes it much more user friendly. And then apply some machine learning on that, so the model gets better over time as well.
Yeah, very interesting. Even if I had a crystal ball, I wouldn't be able to predict the next 5 years. Like that's what's so exciting about being alive right now.
Exactly, especially now with technology, like
Right.
it's changing so rapidly, and it is very hard. I would say it's hard to keep up
Yeah.
with how quickly it's changing, especially in healthcare.
Oh
Some
yeah.
of my greatest work is in the virtual reality space in healthcare.
Really?
Yeah, and that is just, it's mind boggling.
Okay, you literally cannot give us a cliffhanger like that. You have to tell us more.
Yeah, so we have thousands of headsets at the VA, and we have a good number of products as well, software applications that are just focused on healthcare or rehabilitation or mindfulness and well-being, mental health. They just kind of run the gamut. And so we're able to use that with our patients and glean new information, right? So some of the applications come with peripheral devices, which allow us to gather data on range of motion and other things related to patient outcomes, right? But they're doing it all in like a game, like they're literally playing ping pong or they're moving boxes on a farm. And so it's changing the way we view healthcare, right? Especially rehabilitative healthcare. It allows you to be more active, but not in a sterile setting, right? You're transported somewhere else and it doesn't feel like you're doing therapy. It feels like you're just engaging in everyday activities. I've seen some other amazing applications for like art therapy and addiction, right? Which is going to change the way we handle mental health care.
Right. Wow. It's like the possibilities are endless, right?
They are. They really are. So I encourage everyone, stay innovative, continue to find problems and innovative solutions to those problems.
One of the offices in the VA is the suicide prevention office. And I feel like the work that's being done there is so important that I'm just so glad that they're a part of such an innovative agency.
Yes, actually, I've dabbled a little bit with their team. And they're actually using some AI generated responses to train the frontline workers on how best to respond when dealing with veterans in crisis. So
that's really,
we see the innovation coming. We're working to help, support them as well, because at the end of the day, it's all about saving lives and improving those lives as well, right? So don't save them for them just to be blah. But save them so they can thrive, right? And so technology helps us do that in so many different ways. It helps us train our workers. It helps us deliver better, faster. It helps us, improve their outcomes overall. And a lot of veterans enjoy the fact that they get to try new technologies out, especially in the VR space. It's extremely, extremely popular with veterans.
Sounds so cool. Of course. I want to try it out too. Yeah, it's interesting that we're here already, right? Like you feel like virtual reality is like something that you saw on, a movie of 100 years into the future, but actually this is something we're doing now.
Yeah, I gave a presentation internally to Octo and I said the words, "We are living the future." I know I grew up watching Back to the Future, and a lot of what's happening now was happening in that movie back in the 90s. But with virtual reality, right, one of the cool subsets of that is mixed reality. And there are already applications out there where you can put on a device, some type of headset. Typically, it's more like a glasses, more like a HoloLens and less like an Oculus. Right. And continue to interact directly with the patient while seeing their medical record in front of you. So that is extremely, and you're able to interact with that medical record. So it's not stagnant. You can, pull up specific results or, sign a note, check on a reminder, things of that nature, all within the application. Another one of the really cool use cases is for physician specialists, right? So the cool thing about the VA is we have less restrictions around licensing in specific states. And so if you're a VA patient and a VA doctor, you can kind of see each other regardless of, where you're located. But with, again, like at HoloLens, they're able to invite someone in on a Teams meeting and then leverage that specialist expertise in either examining the patient or performing a procedure, having, the expert guide the provider through exactly what to do. And so those are the things that I talk about when I talk about us actually living the future, right? These things they're possible, they're available for us to do.
Could you imagine the implications of this on surgery, right?
Oh, it's
Like
massive.
it's
It's
just
massive.
so, and then even like third world countries and, childbirth in other countries where it can be really dangerous. And this is wow, this is so cool. I knew this was gonna happen and you're gonna be so interesting that we're gonna go over time. So hopefully you have a couple more minutes for me. I have two more questions and I ask everybody these questions. So the last two questions are, if someone was watching you and inspired by your journey, what two pieces of advice would you give them?
So my advice to anyone watching me would be to have a great work ethic and discipline, because that goes a long way with how you're able to navigate your journey in your future. And never forget about continuous improvement or Kaizen.
Right.
If you
Right.
watch me, you see those things repeatedly in my life.
Awesome. I love it. And Kaizen is a Japanese word, actually, like Ikigai, which is
Yes.
like the center point of all the things, right?
Mhm.
Finding your calling rather than your career, right? Kind of thing. Kaizen, like little tiny improvements. I lived for a year in Japan, so I know all
Yeah.
that. But yeah, the little improvements every day, which the reason why I love that you said Kaizen is because it's also a software development thing,
Yes,
right?
I know. It's one of the reasons why I love Scrum so
Yeah,
much, is
right.
because, not only do you have to work at building these things and, making new things, but you are supposed to put time not only into yourself, but also into your product to improve it every single day. And so I do try to be better than I was yesterday, every single day, whether that's answering one more email or finding a new way to explain something or helping someone else. How you perceive your progress is huge at the
Right.
end of the day.
Right. And then second question is, what is your personal superpower and how did you know when you found it?
I think my personal superpower is meeting facilitation.
That's
I
actually a real superpower.
especially really large groups. So some of the initiatives that I kicked off at the VA were like communities of practice around tooling and
Awesome.
DevSecOps practices and things of that nature. And when I tell you, a lot of people have come up to me and they're like, the way you ran that meeting was like so amazing. I had no idea. Like, I just thought that this was par for the course. But over time, I realized that that's something that's lacking, right? Is good meeting facilitation. And I see now, like within Octo, they're working on sharing those facilitation skills and building some like facilitation best practices. We're even kind of playing with the idea of, does every meeting need a facilitator, right? To make sure that we get to the items on the agenda and we really prove the value from that, from getting everyone on the call. So I think that's my superpower. And it's not that I found it, but other people recognized that I had it. So I just honed in.
I love that. No, that having, I think since COVID, we're all living in meeting overload worlds.
Mm-hmm.
Having them be effective is really important and not everybody has that superpower. So, okay, one more question for you. I keep saying Octo, but I think you're not talking about the company. You're talking about is that what the organization is called?
Yeah, so OCTO stands for Office of the Chief Technology Officer.
Okay.
And it lives within OINT.
Got it. Perfect. Excellent. I'll catch you next time on GovCom Unfiltered. Today, Sarah, thank you so much.
Thanks, Alexa. It's been a pleasure talking with you, and I'm so happy that we are networked together, and I look forward to seeing you again.
We will see you at Impact in October.
Hey, yes.
As we draw the curtain on today's chapter of GovCom Unfiltered, I want to thank you for joining us on this remarkable journey through the intricate world of federal contracting. I'm Alexa Choi, and it's been an honor to navigate these stories of courage, innovation, and resilience with you. Until we meet again, keep pushing boundaries, exploring new horizons, and making your mark in the government contracting universe. Farewell for now, but not forever. Stay tuned for more adventures that await in the next episode of GovCom Unfiltered. Safe travels on your path to greatness, and remember, we are all on this journey together.